I'm Renee Crawford, and my project is on health and reproductive. Discrimination of sexism and racism in women's health care can be traced back to the 1700s. It began with Abigail Adams, wife of President John Adams. Her famous line in a letter was to remember the ladies because men could be tyrants. Now, we are all aware that women weren't allowed to be doctors. In 1812, Margaret Ann Bulkley, also known as Dr. James Berry, a name she assumed from her deceased uncle for 56 years. She had been working as a doctor under the table, male doctor. She wasn't the first to go through such great lengths. However, she has also performed C-sections in Africa. In 1849, Elizabeth Blackwell became the first female doctor in the U.S. after the death of a friend. She felt as though if the friend had received medical attention from a female doctor, it would be different. In 1864, Rebecca Lee Crumpler became the first African American doctor, and she was inspired by just simply caregiving of her neighbors. In 1874, the London School of Medicine for Women was established in Britain to train women as doctors. Now, we are aware of the Seneca Falls Convention that happened in 1848, and this is where the Women's Right Convention led, and it led to the women's suffrage movement, which led to the liberation movement. And this was also considered the second wave feminism. This also led to the women's health movement of the 1960s. For decades, insurance companies discriminated against women. They charged women so much more or denied the coverage totally. And so there was no health care services for women. But the laws have changed since then, and I won't go into that. That's Amanda's portion of the project. For decades, medical research focused strictly on men, and but it turns out that there are glaring differences in the ways men and females were suffering from different illnesses and ailments and diseases. I did a little bit more research and realized that in addition to ovarian and cervical cancer, that is totally found in women, there is also Turner syndrome, where the female is born without the chromosome X, and then there's Rett syndrome, whereas little girls' brains are not quite developed in utero. So now researchers are now, they're trying to bridge the gap on that, but we have a long ways to go and on that issue. The for the disparities in males and females. So you ask, when did women become active participants in their own healthcare? It began in 1969 with a nonprofit organization, the Boston Women's Health Book Collective, which is also known today as Our Bodies, Ourselves. They also published a book with the same title. That book helped develop and promoted evidence-based information on girls and women's reproductive health and sexuality. There are times when women's health appears to be, traveling backwards because the framework of to eliminate the gaps and barriers in healthcare with women of all ages, races, ethnicities, social economic background continues to be an issue. In conclusion, I just want to encourage all women to be proactive on health screenings because preventative health is the key. Thank you.